Deepak Rotre, our next speaker, who's surgical oncologist and director of AHPGIC, Cuttack, Odisha. Sir will be speaking on application of cytotron technology, clinical outcomes, and case studies. So, ladies and gentlemen, to give a brief update about Sir's achievements. Sir is a distinguished oncosurgeon with over 40 years of surgical experience. Dr. Deepak Sir is a renowned expert in the field of surgical oncology. Sir has impressive credentials and Sir has an illustrious career that spans over 4 decades with 30 years of distinguished service in armed forces. Sir was honored with the Vashisht Seva Medal by the President of India for his exceptional service. So, ladies and gentlemen, please put your hands together as I welcome Dr. Deepak Rotre on stage. Welcome, sir.
Fortunately, or maybe fortunately, considering the barrage we've been through, I don't have a presentation. I was a late inclusion, so I'm going to just speak extempore on my experiences with this. At the outset, I'm very grateful to the organizing team for having me here and share this experience with this wonderful audience. It's great to reconnect with old friends who've been associated with this and meet new people. Just had the pleasure of meeting Dr. Lim. I've heard so much about him, and the rest of them, it's great connecting once again after years. My association with the cytotron has been real and virtual, depending on whether I've been in Bangalore or out of Bangalore. So I'm not permanently in Bangalore, I've come from outside as just enunciated. So, but the fact that as an oncologist, I see a lot of hope in this is what keeps bringing me back and preserving my association with this light at the end of the oncological tunnel. The diagnosis of cancer, we all know, spells a sense of doom with the patients. It's long back, I remember reading one thing which I find quite analogous to this, is about the Everest. It goes, the Everest is a harsh and hostile immensity. Those who challenge it declare war. They must mount their assault with the skill and ruthlessness of a military operation. And when the battle ends, the mountain remains unvanquished. There are no true victors, only survivors. Well, as an oncologist, I would like to believe that we have victors and we have survivors, and we are hoping that the former keep increasing over the years, and the latter we can hope to give them more hope. Cancer treatment, as we all know, entails mutilating surgery. I'm part of that, unfortunately, yes. Chemotherapy with all its purported side effects, radiation therapy with also its side effects, and newer therapies that are coming in. All this is undoubtedly quite devastating for the patient, both physically and financially. Which is why a lot of patients, there's a lot of non-compliance with the oncological advice, and a lot of patients shirk coming and seeking proper oncological treatment because of the fear and the pessimism that that hangs around this diagnosis. In this kind of darkness comes this little light called the cytotron, which we hope will in due course offer them an effective alternate in the first line, and at the present setting definitely helping to alleviate their sufferings without both financially and physically. My own journey with cytotron has been now more than a decade. It's almost 2 decades that I've been associated with this, and I have often been the devil's advocate in the team since I'm an oncologist, and I constantly keep seeking peer reviews and looking at it from a critical oncological perspective. That notwithstanding, the very fact that I'm here and standing before you and talking about this is that there is irrefutable evidence that this does offer a hope for cancer patients. I would go through a few brief summaries. I will not keep it too qualitative so more people can comprehend. A 53-year-old lady, breast cancer with extensive liver metastasis. She underwent a surgery, underwent her systemic therapy, which was chemotherapy and hormonal therapy. All this was in the year 2020. She relapsed in 2021, and that is when she came to us in January 2021. At that point in time, she had extensive local disease, she had regional nodes, and she had extensive liver metastasis. She underwent a cyclotron therapy in the month of January 2021. As was mentioned by the earlier speakers, the procedure for a review for therapeutic response for cancer for cyclotron therapy is a PET scan. Serial PET scans over the years have shown that the disease is stable in some of the sites and has actually resolved in some of the sites. The multiple sites being the local, the regional nodes, and the liver. She remained, and there was the most significant thing, as already elucidated, is that the general well-being of the patient, which significantly improves. We record it as a performance status known as the Karnofsky performance status, which is universally accepted as a general condition of the patient. And we find a significant improvement in this index in all the patients who undergone this treatment. This patient, however, had to undergo stenting because of the liver metastasis causing jaundice. And a complication of stenting in the biliary tree is at any time you can get sepsis, which may be manageable, may not be manageable. This lady unfortunately succumbed to the disease 2 years after the cyclotron treatment because of the stenting complications. So not a complication of the treatment. Another lady, this is a 57-year-old lady who is again a breast cancer who presented with extensive metastasis involving the liver, the lungs, and the bones. She had undergone chemotherapy and hormonal therapy, as is the routine in a metastatic breast cancer setting. She came to us in April 22. She underwent the cytotron in April 22. The PET CT at that point showed the extensive metastasis involving not only the primary, which is the breast, but having spread to the lung, the liver, and the bone. This was in April 2022. She underwent the cytotron. Serial PET scans over the years have shown that there is a resolution of the disease in some sites. However, the disease persists in some other sites, albeit with a lower metabolic activity. For those of you who are familiar with a PET, the parameter in gauging a PET response is that the metabolic activity is lower, and at best it becomes no uptake at all. So in these patients, at some sites there was no uptake, and the other sites there was a reduced metabolic activity. And from 22, we are now talking of 24, that's 2 years post-treatment. The patient continues to do well with a performance status of 90. The upper limit of a performance status is 100, which is what you and me would be. This lady came to us with a performance status of 50. After the cyclotron treatment and the last follow-up, her performance status is 90. A 54-year-old lady again with an advanced cancer of the colon. This was involving the local organs. She was operated, had an extensive surgery, what is known as a multi-organ resection, in April 2019, following which she underwent chemotherapy, as was the standard protocol. However, in May 2020, on her imaging, she was found to have extensive local relapse of the disease within the abdomen. She came to us for the cytotron therapy, which she undertook in May 2020. She has, on regular follow-ups, the local disease has largely regressed or shown a diminution in the metabolic activity as assessed on a follow-up PET CT. The patient in this follow-up period has taken no other treatment and is currently on a performance status of over 90, as against in 2000, 2 years ago, her performance status was 50. An important factor is that all the patients that we are referring to have, once they've commenced cytotron, not taken any other oncological treatment, which is to establish that whatever benefit or otherwise of this patient can be attributed to the cytotron. This is a 51-year-old lady. Who again is a breast cancer with extensive liver and bone metastasis. She came to us in May 20 with a performance status of 50. The PET CT done at that time showed evidence of disease in the bones, in multiple bone sites, and in the liver. She underwent her cytotron therapy in the month of May 2020. Follow-up PET CTs showed persistence of the disease, but no increase. Now, in the last cytotron done in last year, in the month of December, there is no new lesion, there is stable disease as per the PERSIST criteria, which was referred to before. Now, here again, the important thing is that while the disease has not disappeared, as we are not claiming at this point in time, but the fact that metastasis remains quiescent for 2 years with no other oncological treatment ongoing. The only treatment that this patient has had is the cytotron therapy. So all these data would suggest that there is a benefit definitely in this treatment. We, as already mentioned by the previous speakers, there have been instances where the benefit has not been to our expectations, which is what would be the subject of our further studies, to identify possibly which type of tumors respond better and which type of tumors do not respond better. I realize whatever I say would be claims that I am making. So I would think that the best method is to actually have live testimonials from patients who have undergone the cytotron therapy. I would be most grateful if Dr. Yasmin Shah. Yes, ma'am. I'd be most grateful if she could come and narrate her experience with the cytotron therapy.
I want to introduce myself as Dr. Yasmin Shah. It was in 2006, actually. Just to give you a background, I'm an anesthesiologist who has done my fellowship in Sloan Kettering Cancer Center in pain management. So I'm very accustomed to the cancer treatments which occur there. And of course, I was in the pain management anesthesia group. Later, I practiced pain management in US and Canada, and I relocated to India to the age of my parents. At that time, in 2007, I had a severe headache, which was accompanied with nausea, vomiting, and photophobia. The doctors couldn't diagnose what it was. They thought it was typhoid. They gave antibiotics. I went through about 10 days of treatment. Then, they did a MRI, and it was found to be a tumor at the base of the skull, about 3.5 centimeter by around 2 centimeter size. And since I had been introduced to cytotron, the machine which helps in all the tumors and cancer treatment, the first thing I opted for was cytotron treatment. So, by grace of Dr. Vijay Kumar, he accepted it, and I went through the treatment, and within 10 days the pain disappeared. The nausea, vomiting, photophobia, all had gone by then. And it took about 28 days cycle, and then the MRI was repeated. I don't remember, within a month or so. The tumor had shrunk from 3.5 to less than 2 centimeters and 1 centimeter. And after that, I had subsequent PET scans. The last one was done in 2017 just for my consolation. And even an MRI was done last year. So the size hasn't, it has shrunk and not increased, and the PET scans subsequently were all negative. There were about 3 PET scans done after 2007. So that is my experience, and I wish everyone could think about doing the cyclotron before any other conventional treatment, which is offered for either malignant or non-malignant tumors. Since the result is 100% as per my experience, personal experience. It has been over 17 years and I've never had any other headache or any other complaint related to it. So that is my, experience, where I'm very grateful again to Dr. Vijay Kumar.
May I also call another patient for a testimonial, Mr. Peter Patterson?
I was diagnosed with stage 3B lung cancer, and what everyone else would do, I went through conventional treatment. And may I stress very clearly that I am in no way saying that conventional treatment is bad or not good enough. It has its ups and downs, its success, and which we have been discussing. But it didn't work for me. The doctors have given me 3 months to live. After a year and 14 months of chemotherapy and radiation. And this doctor said, why do you want to meet these people? She said. She gave me a number. And these people happened to be Dr. Kumar. He said they are doing some work in, they have a machine and they treat arthritis. And they are now looking at using it for cancer, reversing the process. Why don't you go and meet them? That's when I met you, doctor. I got grateful. He explained to me and I went through it. The testimony I'm giving is not only what I am saying, but it's very factual because Scaling has it all, registered, documented. And I went in there totally, given, I didn't give up hope. I was happy, I was glad that I was in the right place. I felt that white light kind of awakening. And I went through a process of 28 days. Doctor said, we'll wait, we'll check. My cancer was in my left lung. It was in 5 lymph nodes and in my right lung as well. It had progressed from 3B to 4B. And so I went through this. And first session of 28 days, we waited, we took a test. It had disappeared from the right lung. Then doctor put me through another 28 days. It moved away from the 5 lymph nodes and it had regressed in the primary area. And wonderful. And I went through a third treatment and it had almost gone. I still do PET scans every year, every second year, just to be sure. It's been 17 years now. I'll never say cancer free, but doctors.
Dr. Fee.
I'm not doctor free. I have a lot of complications, but it's not cancer. And this is, post-related things which happen. It's something I accept. It's okay. I'm not. But I'm very grateful, and it's so wonderful. And being here today it's giving me a new angle that, I that's my testimony. But on an emotional, side, I have many friends, close friends, who have passed away because of cancer. Some friends of friends who have come to me asking me, what did you do? And who have also passed away. Only because they were not given enough confidence to actually use cytotron, approach it, go to it, and that sort of thing. And that confidence can only come from the medical fraternity. And today I'm so glad that I'm here. I'm seeing Dr. Meena and Dr. John Augustus for a long time. They worked very hard to spread this. Dr. Anjana, she was there with me in the beginning. And it's so nice to hear Dr. Lim. I mean, we need more doctors like this and Dr. Yeh, who actually, I enjoyed listening to you, Doctor. Very clearly you said that you have to bridge the gap. You're talking about operations of stage 1 and stage 2 and stage 3 where you had problems. You set it on stage 3 and then come back and operate. And that's so wonderful. And I wish I could speak more because I love cytotron and I can advocate for it day in and day out. And I can only say, there are many doctors here. You all are great people. Thank you very much.
Thank you. Can I have Mr. Manohar, please? Mr. Manohar has an issue with his voice. He is a case of cancer of the larynx, what we call it the supraglottic larynx. So it involves a voice box. So he has a hoarseness. So he will not speak himself. When did you get the cancer? 2020. Okay, so September 2020 is when he had the cancer. He underwent surgery of that area known as a microlaryngeal surgery, which is a limited surgery which just removes the tumor, and it mandatorily needs to be followed up with radiotherapy or chemotherapy. However, you never took any treatment after that. So from 2020, after this basic surgery, which diagnosed the carcinoma of the larynx, supraglottic, he said that was the stage 3. He has not taken any oncological treatment. When did you take cytotron? Anything after that? So, diagnosis which would mandate oncologically follow-up radiotherapy, chemotherapy. Nothing was exhibited. Manohar has only done cytotron after that. And we are talking of 4 years now from then. And Manohar is hale and hearty. Any even minor procedure on the vocal cord would leave you with a certain amount of hoarseness of voice. It may not be disease related, it is treatment related. So the hoarseness of voice which he has now, which exacerbates with season, with a little throat infection, is not to be construed as a relapse of the disease. He's on a regular follow-up, he's getting his MRIs done. As of now, there is no evidence of any relapse. Thank you very much. Yes.
I just said, God gave me life and you saved me life.
I want to introduce myself, that this is Shailaja, cancer survivor of oligodendroglioma stage 3, which is a brain cancer. For the surgery, they kept me on steroids and did the surgery. It was major brain surgery, 2020, which was followed by that tumor progression or radiation necrosis. So they want me to go for again resurgery in 2021. So for which I said big no, because I didn't even recover completely from the first surgery. They are planning again, resurgery. Only God knows what the hell I have gone through. But I rejected that resurgery. I told them, but the only thing is, yes, I took this cytotron treatment in October 4th. I started on October 4th, 2021. And I checked with the other doctors also. They said, no, you have to go for resurgery. So what if I don't go for resurgery? I found with them. They said, a lifespan of 6 months to 1 year. They even scared me like that. Not a problem, because I made up my mind. I would prefer going for death than going for resurgery. So that this God has helped me with cytotron, and that 6 centimeters tumor size has decreased to 10 mm now.
And this year they didn't even mention the size also. So I'm always forever indebted to Raja sir, and thank you for giving me this opportunity. Thank you so much.
So I think that's enough proof of the pudding. Most of us are able to consume it verbally at least. And with that, I thank you very much for this patient hearing. Thank you.